very interesting conversation that we are having. But on the flip side, have you had cases where a patient wanted the robotic arm but then had to opt out for the conventional one due to insurance or any other limitations like that?
This is a very key part of my discussion because I am very much for advancement, but certain places like insurance, it is not getting approved to the patients and they are suffering. So manual, of course, we can do it, but the robotic effect is like a extra star for the patient function and longevity. So many insurance companies still they are lagging behind. They are not giving, some are giving some half, and there's a major problem all over the India, and that definitely restricts our advanced technology use benefit to the patients. So that is very important point I want to raise, that insurance should follow the advanced technology, and India takes technology to a very high level very rapidly, but insurance company gives a break for this, and we should definitely uh, put this point for insurance to improve the advancement of this technology for patients' benefit.
Okay. Dr. Bhosle, you mentioned 21,000 surgeries. What kind of conversations do you have with patients and families when cost becomes a barrier? How do they react when they learn that their insurance might not fully cover the procedures?
Because the surgery is the only option for arthritis. There are some injections, there are some physiotherapy, and painkillers is a false medication which gives a false relief. And surgery resurfacing is the only option for their walking and day-to-day activity. Their life completely changes. I have a record of patient of 18 years bedridden and walking after 18 years after joint replacement. So that's a very important message, because arthritis patient demands that they cannot walk, we assess, and the only option is surgery. And implant and technology has to be the perfect, and we use international implants because they are FDA approved and their longevity is better. The robo is also uh, highest technology. It makes the surgery better, faster, recovery is better, and longevity is better.
Okay. But then, are you seeing more demand from tier 2 or tier 3 cities? What does the access to robotic surgery look like beyond the metros and the hospitals located in metro cities, so to say?
To tell you frankly now, India is really advancing very rapid. Even tier 2 city like I'm at Bombay, Pune, they have plenty of robots, and patient demand and doctors, surgeons demand for technological advancement is really growing in India. India, I would say, is number one for advancement in technology. So even two-tier cities, they are also gripping up and trying to get a robo for their better patient care and advanced technology for better functioning and better longevity of the patient. It's very important. It's really spreading very high.
Dr. Bhosle, middle income families often are the ones who carry the biggest burden. They don't qualify for government schemes, but also don't have deep pockets. How does this impact the surgical decision making in your experience?
This is a very important aspect. Now, if you do a proper surgery, joint replacement, using the best technology, the longevity is the very best benefit. So if they last for 25 years, it's a very good thing. If you do improper technique and it fails in 5 years, the patient requires a revision surgery, and that costs 5 to 10 times more than the primary surgery. So that becomes like a big Pandora's box for their financial pocket. So one surgery with longest benefit is the key point, which will really long term, it is a savior for them, financial also. Their function also, they can do their job more efficiently, they can earn money, they can walk and do they're living very effectively. So that part is important. just the initial cost, but longevity definitely makes, and perfection makes the benefits definitely better.